Cosmetic surgery in 2025 isn't about mimicking influencers or cloning celebrity looks. It's about amplifying your unique vibe. Want the inside scoop on what's driving this revolution? Stay tuned as we look at the past, present, and future of trends in cosmetic surgery.
Welcome to The Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Graper Harper Cosmetic Surgery in Charlotte, North Carolina, The Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper and Dr. Robert Graper, also known as The Doc Dudes.
Welcome to another episode of The Doc Dudes. This is Dr. Garrett Harper, joined by
Robert Graper.
And it's just the two of us today, but both board-certified plastic surgeons with a few years behind us. Today we're talking about trends in cosmetic surgery, including past trends, what's hot right now, and what we're going to see as the future to cosmetic surgery. I just want to take 30 seconds, probably going to be longer than that, and talk about trends. And I have mentioned this on social media before because I see a ton of posts from other plastic surgeons, from influencers, from dermatologists, from cosmetic surgeons who aren't really plastic surgeons, but all sorts. And they're going over what trends are, right? And like what's out there, what's the new thing. Right now it's like ballerina breasts. That's what they call them.
B cups.
Ballerina boobs, right? And I have posted that I think the best trend that we can set for 2025, 2026, whenever you want to do this, the best trend is to not follow trends, right?
100%.
Following trends is what got us into trouble. And we'll talk a little bit about the past and what we saw as far as, huge saline implants placed through the nipple out in, LA in the Baywatch years and all that kind of stuff to, Brazilian butt lifts where we're putting in a bunch of fat inside somebody's rear end and over liposuctioning them in other areas. And not everybody does that. There's some really great surgeons out there that do a very beautiful job. But at the fundamental component of that is filling a rear end up with fat. And what's that going to look like in 5 years, 10 years, 15 years, 20 years?
Iron abdomen that's supposed to look like a six-pack, but it looks like a waffle iron.
That's exactly right. From the abdominal etching and all that kind of stuff. So let's focus a little bit on, first of all, I want patients to realize you have a unique figure. You have a unique opinion. You have your own opinion on what you think is beautiful. And there are lots of trends out there that I think, and lots of kind of external, pressures to look a certain way. And I just think that following those trends, listening to those things is a horrible idea. I said before in social media posts, this is not a hairstyle. This is not a handbag. This is not
wallpaper.
Yeah, it's not a tattoo. I mean, how many people are really loving those barbed wire tattoos going around their arm right now, right? Or the tramp stamp. Not a good idea, right? How many people come to you and are really excited about that belly button ring that they got 25 years ago when they were at Myrtle Beach? Not a whole lot, right? So don't follow trends, especially when it comes to your body. This is modifying your body to make you
the best that you can be.
That's exactly right. The best you can be, the best version of yourself. So you know what you think is beautiful. You know what you've always kind of wanted your breast to look like. You know what you've always wanted your nose to look like. So go with that, right? Don't go with trends. This is something that we hope you enjoy for the rest of your life, and that doesn't take a lot of upkeep and can be very natural. And so that's my advice, first of all. But let's talk a little bit, Dr. Graper, about the rise of plastic surgery when we started really seeing it, I'll say in Hollywood and things like that, because back in the 1980s, that was probably driving a lot of it, were pictures in Hollywood and things like that. So talk a little bit about the rise of plastic surgery in the 1980s and 1990s?
Well, a lot of it was just technical advances. Liposuction is a good one. I think liposuction started by that French guy, Ulus or something like that, in 79. And before that, didn't exist. And now they're vacuuming fat out, sculpting, if you would, like whittling down a person's body of fat. And it has stood the test of time. It's still widely used, widely effective, done properly.
Right.
Like anything else, you can mess it up if it's not done right, but you can make a patient the best they can be. Now, you can't take somebody who's 5'3" and 180 and make them look the same as somebody who's 5'3" and 110.
Right.
It's not a weight loss technique. It's a sculpting technique. But if you lose 2 pounds off your abdomen, that's like losing 20 pounds off your whole body, as an example. It looks like.
Yeah.
So that was an advance in the 80s. Breast augmentation started in the 60s and got improved and improved. So now it's much better than it was then.
Oh, yeah.
But that has stood this test of time, although shocking to me and you that the number of augmentations is the same roughly now as it was in 2000 or maybe even 1990s. Probably more in 2000 than it was in 1990, but I thought it'd be triple.
Yeah.
With all the focus in America on the feminine shape and breasts and how they look in different dresses and sweaters and outfits, but it's still holding steady at about.
Well, and I think there's barriers to that, right? I think there's barriers of entry to the breast augmentation and breast implant market. And I think a lot are based off of incorrect assumptions and stories and data. And I think the use of terms like breast implant illness incorrectly.
The media doesn't seem to like it.
Yeah, no. And I think all it takes is, one celebrity and a couple of hack doctors to kind of, who have influence, who have social influence to kind of assuage people. So I think we're up against it from that standpoint, but all we have to do is just counter that with proper education.
Truth.
Right? Proper education and truth. Absolutely. What about like cultural influences? Think about like in the 1980s and 90s, some stars that may have
I would say Raquel Welch pushed breast augmentation, whether her breasts were natural or not, they certainly were made important by the media. And so ladies that didn't have that wanted it, and there was a technique they would get it for them.
Sure. I think that, you obviously there have been influential people from a stylistic standpoint and from a body physique standpoint that have influenced all of our culture. I think, a big one for that time would have been Pam Anderson in the 90s and Baywatch just kind of in general, right? Because I think that probably pushed a lot of people towards breast augmentation surgery. I think the majority of us, and I think she might admit now, I don't know, I'm not going to put words in her mouth, she was gorgeous before she got the breast augmentation. When you see modeling pictures of her in the early days, she was quite stunning. And I think this idea of Hollywood and the Baywatch and all that kind of stuff, I mean, that doesn't just stay there. That goes across the globe, right? And so you started seeing breast augmentation and a very augmented look happen, which has changed now, which is great, which I'm super happy about.
It had gotten almost to be a caricature.
That's exactly right. The Jessica Rabbit on Who Framed Roger Rabbit. That was another one.
I'm not evil. They're just drawn me that way.
That's exactly right. What a great line. My gosh, what a great movie. And then I think there's, facial things that become in vogue because of some people, right? I mean, you start to think about some rhinoplasties and nasal procedures on,
Michael Jackson,
who, pushed the envelope so much. I don't even think he had a real nose at the end of it. I think it was a prosthetic that he wore. So you can really push things and see trends, and you start to see that in the 1980s and 90s. I think that we are a very, aesthetically driven culture. I think the United States in general is that way. And I also think that we have this huge celebrity infatuation. I think you see that from, our president, I think that there's just some infatuation with that. And so I don't think that was healthy at the time, and hopefully things are kind of changing around a little bit, right? How about the 2000s, right? Like in the early 2000s, I don't know that that breast trends had changed too much. I still think that those were pretty popular, but you did start to get into this regimen of hearing about less invasive things for people, right? Like the introduction of some fillers and Botox and things like that became super popular. How people were able to kind of make improvements short of having to undergo surgery.
Yeah, Botox was a huge advance, and fillers combat the known process of the face deflating over time and sagging. And so some of those things are as an adjunct to regular surgery, and some of those things are all someone needs at a given age. They're not ready for surgery. So that was very helpful.
Yeah.
Laser treatments similarly took the place of chemical peels or were another technique, and they are very effective for what they do.
Yeah, hugely important. Now, I'm gonna forget this name, but I bet you'll remember it more than I will. But I felt like there used to be, and there were like infomercials on this, right? Where there were these lunchtime procedures, like lunchtime facelifts and things like that. Do you remember those where people would talk about like doing it under local and coming in at lunch and doing some of those things? I mean, in the right hands, I think you can accomplish a lot through some of those techniques. But what did you see from, everybody wanting to take a weekend course? A lot of doctors in Florida, California, places like that were wanting to take some weekend courses because they just figured, well, we're not doing a full facelift. We're just kind of making an incision and doing this little thing. What was your experience with that?
Problems.
Yeah.
People who were real plastic surgeons didn't bother with it because they knew it didn't work. And the physicians who were doing it were not looking out for the patient, they were looking out for themselves. And you would either see no results or bad results, unnatural looks, problems that we would have to fix.
Yeah.
So there's a trend that should have been ignored.
I love that. All right. So Botox in the early 2000s really rose to fame. Fillers such as Juvederm and all those types of things. We were starting to see a shift, right, from just kind of plumping things up. I think we saw a lot of overly operated faces, overly plumped faces.
Overly plumped lips.
Yeah, overly plumped lips, which can be a disaster as well. And those started shifting to a more natural and normal kind of ratios, proportions, dimension. I remember I thought it was phenomenal in my plastic surgery training when you would see people that literally dedicated large studies to diagramming the face and even the breast and going over proportions and ratios and where the kind of standard was. I make some jokes sometimes when I'm measuring patients and doing a consultation that if their nipple position to their sternal notch is an equilateral triangle, I'm like, oh, you're perfect. Leonardo da Vinci would just say that you're perfect too, those types of things. So there are kind of, I guess a lot of them are agreed upon, or at least in our field, there are these kind of ratios and proportions. And I hear you talk about it all the time. This must have been something training at UT Southwestern with the group that really kind of came up with all of these. I'm sure they are, like rambling off your grandkids' names. It just kind of comes right at it.
Golden rule of Farkas.
That's right. Scott Farkas? Wasn't that the guy who beat up the guy in A Christmas Story?
Yeah, I don't think it was the same Farkas. Maybe it was his dad.
I don't think it's the same Farkas either. But super, super interesting that all these papers were coming out that kind of, I think, tried to standardize and maybe have plastic surgeons and the providers that were doing these procedures think about things in relation to not just kind of eyeballing it or spitballing it and say, yeah, it looks good. I think that's about right. We were really measuring things and putting things, almost calculating where things were supposed to be. And I see you do that all the time.
Especially for noses.
Yeah, especially for noses, looking at different angles.
Proportions.
And proportions and all that stuff. Super, super neat. All right, so then the 2010s, right? Awesome. really great time because in that decade, we're talking about everybody had a camera on them at all times because it was on your phone. So everybody started having iPhones, Samsung Galaxies, all those things. You know, I think I got my first, I don't know, like smartphone is I guess what they called it. Didn't have a flip phone.
Probably early 2010s.
Yeah, somewhere in there.
Seems like we've had them forever, but we haven't.
Yeah, I remember like the first guy had it in residency in like 2007 or 8 or something like that. And we were like sitting in a conference and he was like, you can Google what the score of the Braves game was last night. You're like, oh, are you kidding me?
Yeah.
All from your phone in your hand. That's amazing. So people started taking selfies, right? You start taking a lot more pictures of yourself, which brought people, brought their attention to maybe things that they didn't like quite as much. I mean, gone were the days, right, of like pulling out a camera and taking a picture and going to get it, processed and developed and then going to pick it back up and all those things. Like that was, I mean, you had to really want a picture of something back in the day. You just don't have to do that as much now that we've got our phones, which all have really great cameras. When social media kind of started taking over, probably, mid to late teens, obviously it was ramping up prior to COVID-19, but during the COVID time, we really saw it ramp up. I mean, people went from being influencers and having Facebook pages, and then Instagram and TikTok came out, and then people became like, I mean, that's their job. I mean, you can make a living. You can make a lot of money just by having people visit your social media account. And so that really, I think, changed the game because people just became addicted to their phones. And not in a good way, but it just really put kind of the impetus on, I think, social media to be, I don't know, just more aware.
You think it's more current?
Yeah, well, I just think it's like they needed to take responsibility and realize just kind of how huge of an issue this was.
So do you think the trendy things were amplified more than they would have been?
Oh, 100%.
So that was probably not good.
Not good at all. I mean, I think you just see total... I also think that there comes a time where you get so bored of seeing things so often that you start to look at the extremes. And then the extreme starts to kind of become your norm, right? It's like when people come in and
for lips, as an example, or breasts.
Some leave our office and they're like, that's, wow, look at her lips. And like a lot of times it's not our gals even touching them for that. They're coming in for something else. And you're like, I hope the people in the waiting room don't think they got their lips done here. But nobody went from like normal, right, to looking like the freaking cat lady that we see, pictures of. Like, you just didn't start from that. I mean, you see the before and then you see the now, but you don't see the transition of how things changed over time, the course of decades for some of these people, because I just think that their norm gets shifted. And I think that that's another culprit of having some very unnatural and poor outcomes in cosmetic procedures and in surgery. But we definitely started to see more people that became social influencers that were reaching, millions or even billions of people. I think some of these, Kardashian's a great example, right? I mean, it's super scary to think about, but just how much influence they've had on international culture with really like, and I don't mean to say they have no talent. Obviously they've got talent. They've got mega empires. They're good business people, and not everybody that's successful needs to have a shtick. You don't need to like hit a baseball far or be able to sing beautifully or whatever. I mean, fill in the blank, right? Like they deserve their success and that's great. But I mean, to know that things like the Brazilian butt lift became so popular because people started to look at her rear end and want to emulate it. I think pushed us towards trends that were not safe. And I think some people's, and I don't even know if hers is natural, I wouldn't even begin to make that assumption, but some people's natural bodies are fine because they're natural, and it's safer and it's healthier because that's just the way that they were made. Little wastes and things like that, right? All those things. But when you start modifying your body, that's against kind of how your body was constructed, how your body's been built, how your body genetically is, I think you get into a lot of problems.
No question.
Okay.
And that's where the plastic surgery community should say, well, I understand that's what you want, but here are the reasons why we don't think it's a good idea. And then you and I probably would just, if we can't convince them, just say, well, I don't know that we're the right group for you.
But you and I are afforded, and a lot of our friends, right, in the plastic surgery world are afforded that luxury because we've got really great practices. Like if somebody leaves our practice and goes somewhere else, it doesn't change our life, you know? And so we're able to be super honest with them, which I think is of huge benefit to our patients and to us because we're not forced to do things that are bad. But you and I both know if that patient comes in and asks for something that you and I don't feel comfortable with, there's somebody that's going to do it.
Well, I mean, but we can educate them. And so if they go to that person, they will have more knowledge than not just think it's going to work and going to be great. They're going to have a counterpoint.
Yeah.
And that's about all we can do.
Yeah. And I would love to think that our honesty and transparency about where we have issues with some of the trends and some of the things that people ask for would hold a lot of weight with some of these patients, but some of them, I mean, they are so, their mind is set and they are just looking at who's going to do it. And so until we get kind of the whole community to make those decisions and to act in the best faith of our patient, I think we're going to continue to see catastrophes that we do. And medical tourism is another issue, right? I mean, there's plenty of people who travel all over the globe. I mean, there's places that are, 2-hour flights from Charlotte, super easy to get to, and for a fraction of the price is what they always say, right? You can stay here for 2 weeks and a nurse will check on you and you've got a room and board and all that kind of stuff. It's just, granted, we see a lot of the problems. We don't see a lot of the success stories. But man, it is...
no recourse if you have a problem.
Medical tourism is another trend that I just think is awful. Which brings us kind of to the early 2020s, right? Which, we're mid-2020 right now. But I do think there is no doubt, and I think I see this across the country, across the board, with almost every procedure. Tell me what you're seeing. I'm hearing the word natural. I'm hearing the words minimal, moderate, conservative. I'm hearing those things a lot more than I even heard 5 years ago.
Good.
Same for you?
Yeah. And, if somebody wants minimal results, well, if they want minimal results, are they going to feel like they're getting their money's worth, quote unquote? So again, we need to educate them, and maybe they're too soon, or maybe they just never want to look, if you're talking about faces, maybe they never want to look bad. And if they get a 10% improvement, but that 10% makes them look just like they do for another 10 years, that's good. Whereas 20, 30 years ago, they wanted a 50% improvement, but that means they had to look bad enough to get a 50% improvement.
Right. But I hear you talk to your patients and your consults and people just in the hall when you're talking about rhinoplasties or facelifts and things like that. These people are, you're hearing things like well rested. I want to look like, healthier. I want to look, and when you talk about nose changes, when you've brought people into the office and shown them kind of their simulation and you show them kind of 3 options, it's like Goldilocks listening to people now. I mean, they're choosing the kind of moderate, the one in the middle, you kind of say like, oh, we can shave this hump down like this. We can shave it down a little more, or we can ski slope this bad boy. What do you want? And like, letting them see what they can look like. I think is critical
very helpful.
to having people make the right decision and see where our philosophy, why we're saying that too, and wanting them to do that. And I see that in breast surgery as well. And I don't see a lot of...
How helpful was imaging for you in breast surgery? Do you think it was good enough that gave them a realistic expectation, or was it still, we said this is a 330 and this is what we think it's going to look like, but you put a 330 in, were they happy, unhappy with that?
So I think that it was more helpful earlier in my career. I think that it kind of gave me like a marketing angle to be able to take a picture of somebody and oh my gosh, yeah, that's me. Wow, those are my shoulders. Those are my breasts. That is my belly button. That is that mole right there. And then all of a sudden you're able to like add implants to it. I think that there's limitations to any three-dimensional analysis that just kind of throws it up there like that. I think that I see a lot more people that maybe just with my age, I see more people that are kind of combination breast implants with lifts and things like that. And so I don't think that the analysis and the three-dimensional software was great for that. I just tell people now, I'm like, look, you send me wish pics. And that's what I want to go after. And that way I'm not scrubbing out and asking your husband or your boyfriend or your best friend or your mom or whoever, like, hey, which side do you think looks better? And, we know you've told us what you want to look like. And then I tell people kind of tongue in cheek a little bit, I say it's just an art project when we go back there, right? It's like sculpting, whatever. And just using the components that we need to get you your goal. But I think that the 3D stuff isn't as important in my practice now.
Okay.
But I think some other things that people do can be really misleading, like when we used to put bras on people and have them place an implant over that. I do not think that that's really good. I also don't want people to like get fixated on a number or a particular implant size or anything like that. I really just want them, or a bra size. I say, we're not talking bra size. We're going for a look. And if this look on your body makes you this cup size, it is what it is. But I want to match kind of visually what you think is beautiful. I don't care about letters and numbers or any of those things. But, I also think that when you talk to our nurse injectors, I think that they will tell you that people are definitely asking for subtle changes, maybe in more places, right? As we start to get better at addressing the whole face. I mean, it used to be people came in for Botox and it was like forehead and your angry 11s, and that's what they did, right? And if you needed some filler, maybe you put a little in the cheek and maybe you put a little in the lip. And wow, there were kind of two different ones that you could use depending on that. I mean, now look at what they've got. They've got umpteen different fillers for different parts of the body.
Velour, Voluma.
Right. And they're just able to use these in different areas. And I think subtly change more places on a person's face so that they get a better overall natural result. I mean, just adding a bunch of volume to your lips or to your cheeks. In where things are right now, we've gotten so much better at it. They've gotten so much better at it. I don't do it, but so I just think that that's super neat. That I think we're trending towards a more natural look. And when people come in and say, "I don't want anybody to know that I had surgery done," I'm like, "Do you mean like your loved ones or your best friends? Because they're going to know." I think what they mean is when they're out and about at a restaurant or poolside, that the first thing those people that they have never met before think is this person's had plastic surgery, which I appreciate a lot of, right? I'm sure you do too. Beyond, the future of cosmetic surgery, where do you see this kind of going?
Well, the AI stuff, I think is kind of like the simulations where it can probably tell you what is reasonable, but we don't know yet.
Yeah.
I think some of the regenerative medicines with DNA and changing your cell types and just way over my head.
Yeah.
But that's, if it's coming for regular medicine, it's probably coming for aging too, which would be great.
It's here. It's just a matter of when the FDA kind of clears some of these things. And there's regenerative medicine that's offered in, the UK. I mean, Germany, a bunch of those are well industrialized countries that are available there. The FDA is always a little bit, lagging behind, and sometimes that's good. But I think from a regenerative medicine standpoint, I think, not to get into conspiracy theories, because I know you want to yell at me about that kind of stuff, but I just think that there's so much power in pharma that I think it probably slows the process down for us to get some of the regenerative medicine stuff working. Because I think that there are some ways that we can treat our body, treat our health, beyond just kind of taking medicine, swallowing pills, and doing stuff like that. So I think regenerative medicine is going to be a huge factor in cosmetic surgery in the next decade, and I hope that it does. I also think we're going to start to see maybe more frequent but less aggressive therapies. I think people are going to start to whereas laser treatments and some of the microneedling and things like that were kind of a once a year or once every 18 months because of some of the recovery that went with it and things like that. I think you're going to start to see those procedures done almost, certainly on a more frequent basis. And then I think, as we continue to try to improve our health of our country by losing weight, specifically now GLP-1s, which are also only going to continue to improve, and the use of peptides and things like that, which is some of that regenerative stuff you're talking about. I think it's going to be paramount that we really get a handle and solidify technology and some devices that are going to help tighten skin, right?
Non-invasive skin tightening.
Non-invasive skin tightening. I think there's just so much bogus devices out there that don't work, that are a black eye to our industry.
Credibility problem.
And to the credibility. But, surely somewhere, someone out there is looking at this, because it's only going to become more important as people continue to lose weight. I mean, you lose 100 pounds, the minimally invasive devices aren't working on you, right? But I mean, how many people do we see now that instead of and I'm not saying this is wrong, but who have 15, 20 pounds to lose?
How about the lady who doesn't have any weight to lose, has had a baby, or just genetically skin tone isn't that good, maybe had a lot of sun?
Yeah.
Lots of reasons to have skin laxity, just normal aging.
Yeah.
And have something that doesn't require a scalpel and a scar, and the downtime would be huge.
Huge. And I just think that they're going to devote a lot between combinations of these procedures with regenerative medicine. I think we're going to see even better outcomes than we're having right now.
We're going to have something topical as
100%.
well as something that's minimally invasive. And
absolutely.
And you do it 3 or 4 times and there's no downtime, so it's not so bad to do it 3 or 4 times.
Absolutely. Yeah. So I'm excited about the future of cosmetic surgery, plastic surgery, and skincare and all that. I think that there's a lot on the horizon that's going to make things even better. It's just a fun time to be practicing and be in the thick of it. If you've got questions or topics you want us to cover on the Doc Dudes, head to ghsurgery.com and click on the Doc Dudes from the homepage for a link to submit questions. Subscribe so you can never miss an episode. New episodes drop the last Tuesday of each month. You can find the Doc Dudes on Apple, Spotify, YouTube Music, and everywhere you listen to your favorite podcasts, as well as through our website. Don't forget to follow us on Instagram and Facebook for the latest on new episodes in our practice. We hope you enjoyed us talking about trends, both in the past, present, and future in plastic surgery. But remember, the kind of underlined, italicized, bold-faced message that I'd like to present is quit following trends. Right? Like, just stick to your guns, what you think is beautiful. Don't do what other people are doing. Do what you think is right, and we'll help guide you here at Graper Harper Cosmetic Surgery. So I am signing out. This is Dr. Garrett Harper.
Robert Graper.
Ciao.